Okay, we're back to discuss the pedigree, which is a very useful tool that healthcare providers can use to visually represent a person's family medical history. And sometimes at a glance, you can almost calculate the risk, and we're going to do some examples of that. So, a pedigree is made up of symbols, and it gives you information about the phenotypes that occur in a family. That's usually all people know about their family history. Um, but it is useful in demonstrating those. Symbols, I'm going to give you a link right there. If you were to follow that from the Google Slides, um, you can get to this page. And that gives you all of the symbols that are affiliated with pedigree. They're all standardized, and there's a good reason for that. This is an example of a pedigree right here. You can see it's 4 generations. The proband is the name for the person that is inquiring or is bringing us this concern. So here's the proband here, and we know that because there's an arrow. And there are 1, 2, 3, 4 generations represented in this pedigree. And that's just kind of an overview of that. So a good pedigree is a graphic illustration of the members' positions within the family and the family medical history. It's important to note where the lines are. It's important to note what the shapes are. They give you a lot of good information about multiple generations. Reason behind the standardized pedigree symbols is that it eliminates confusion. Anyone can look at this pedigree who understands how pedigrees are created and understand this person's familial risk. The circles represent people assigned female at birth. Squares represent people assigned male at birth. As things get more inclusive, you may see an evolution in pedigree symbols, but for now, we'll refer to them as men and women, unless otherwise stated. And circle means biological female, square means biological male. The lines depict the type of relationships, okay? And so from these lines, you can decide how much risk a person has. If they are first degree relative, more risk. Second degree, not as much risk. People who are unrelated, like this uncle who was adopted, no risk relationship. Lines. So this horizontal line going from this square to this circle means that there was a partnership between these two people, which resulted in mating and the production of offspring. They had, this vertical line is a line of descent. There were 3 children in generation 2, 1 male and 2 females, who are connected through this one line. So all siblings, full siblings, should be drawn from the same line. A diagonal line through a box, or a shape, I should say, square or circle, means that the person is deceased. So there it is. If there is no slash, person is still living. When there is a slash, there should be an age and a cause of death indicated. That gives us really important information about this person's risk factors. There's the proband. That's that big arrow. That's the patient you're working with. And it's important to indicate who that person is, because as these pedigrees are drawn, they can get very complex. Everybody's got a different family dynamic, and these pedigrees don't look the same for anybody unless they're full siblings. So it's important to indicate the proband with that arrow. The sibling line here is called a sib-ship line, indicates that 50% relationship genetically. So to have an example of how pedigrees can evolve and get a little bit complicated, we have a woman here in generation 1, indicated by the circle. She married a man in generation 1. He has a square with a slash through it. That means he's deceased. There is a vertical line, a line of descent, goes to their son, this square here. But then she remarries. There's a new relationship line, a new mating line, to a new square that is a different individual. They have 3 children. There's that line of descent, separate. And the sib-ship line only covers these 3 full siblings, but they're all in the same row for generations. Okay, so that would be how you would indicate that. These can get incredibly complex depending on how many marriages and how many children, and you can get very complex with a pedigree. It's helpful to have a pedigree maker if you do these, but in this diagram, we're going to show how social relationships happen. So there's a man mated to a woman. They had 3 biological children, 1 adopted. The adopted sibling has a dotted line of descent and brackets around the shape. So that daughter was adopted, and that shows that there's no biological relationship. So when we're looking at a pedigree, yes, we want to include all the siblings, but here's the proband. His risk odds ratio is not affected by this sibling because they don't share any genetic material. If we want to indicate twins, so here's your proband. He has a brother, he has a sister, and then there was a set of twins. They will be indicated by 2 separate shapes coming off from the same point. If they are dizygotic, meaning 2 zygotes, 2 fertilized ovum, for fraternal twins, they will just have these 2 lines. If they are identical, monozygotic, they will have an additional line to indicate that they share 100% of their DNA. If we want to indicate pregnancies or perinatal losses, and yes, those can be important, we would indicate them this way. So if we know the sex, if we don't know the sex, it's going to be a triangle or a diamond. If we do know the sex, it's a circle or a square, same as always. But a diamond with a P in it means that this is a pregnancy and the sex is unknown. If we want to indicate perinatal loss, that shape, that circle or that diamond will be smaller than all the rest. And it has to be visually smaller so that we understand that it is a loss and not a living pregnancy. If it's just a plain circle or triangle, that means a miscarriage or spontaneous loss. Could be a stillbirth, but it's a spontaneous loss. If there is a slash through it, it is an elective termination of pregnancy. Okay, consanguinity, when 2 people are related and have a mating line, it is a double line. Rare, but it does happen, and in some cultures, might be more common than others. In my practice, we had a couple. They were first cousins. They came from Honduras. Their babies, they had 2 babies with a rare connective tissue disorder because they were both carriers of this disease. The 3rd baby was unaffected. If you were to draw a pedigree for these individuals, you would see the circle for the woman, the square for the male partner, and the double lines indicating that they were related biologically. They were first cousins. Okay, childless couples are indicated by a mating line with 2 slashes. If there's known infertility with a physical risk factor, you could indicate this. So in this instance, we have a male who has cystic fibrosis, and because of the pathology of that disease, he is infertile, and this couple had no biological children. If we want to show multiple traits, we can do this. Or if we want to show any disease traits. Generally, if it's a single thing that we're looking at, we want to know their risk for von Willebrand's disease. An affected individual would have a shaded shape. An unaffected individual would have a transparent shape or a blank shape. So if it was von Willebrand's disease, the mother had it, did not pass it on to any of her children. Now, if we want to show multiple traits, we can make a little key like this. And you saw diabetes type 1 is left lower corner, asthma, right lower corner, hypertension, upper right, coronary artery disease, upper left. So the father in this couple in generation 1 had a history of hypertension, coronary artery disease. Mother had von Willebrand's. They had 3 children. 1 son who had diabetes type 1 and asthma, a daughter who had no known disorder, and a son who had asthma. And that could be a way that you represent it. But these can get really complicated, and it's probably better to make sure that you have a clear key, and I would not do more than 4 traits in any one pedigree. A useful pedigree should include at least 3 generations, should use Roman numerals to indicate the generations. Roman numeral 1 would be maybe the grandparents. Roman numeral 2 would be the parents, and Roman numeral 3 would be the generation where the proband is. Arabic numbers go from left to right for each individual in each generation. So from a couple, the oldest sibling is Arabic 1, his younger sister is 2, his youngest brother is 3. I'm going to show it to you because it's hard to describe it in words. So, generation 1, Roman numeral 1. That's mom and dad, a square and a circle. Here's a line of descent. Here's the proband. Now, depending on how far back you go, the proband could be anywhere, so we need an arrow. This generation, this couple produced 2 children. They were both males. So you can see the vertical line of descent, sibship line. Just these 2 squares on the sibship line. Now you can see from this diagram, mom had a trait for something. The proband has that trait. He has mated with a woman who does not have the trait. That's a mating line. We have a line of descent going down to 3 children. 1 male, 2 females. And their offspring, 1 female, has the trait. On the other side, this is the proband's brother. He is unaffected. His partner, indicated by the circle, is also unaffected. There is a mating line, a line of descent. They have 3 children, and their first child is a female who is affected by the disorder. Second child is a male, unaffected. Third child is a male, affected with the disorder. So this gives us kind of valuable information. If you look at this just at a glance, you can kind of see generation 1, generation 2, generation 3, how many people, and how is it being transmitted. And we're going to stop there and move on to pedigree analysis next.